For the online stuff, I like it because it's a little bit more preventative, where I feel like our medical system is a lot more reactive instead of proactive. So I feel like if we can reduce the risk of things happening, then that's going to put people better in the long run and improve their quality of life for longer, versus just reacting once they already have an injury. So that's kind of where I like the balance between the two. I think the social media side of things makes things a lot more of flashy online, but in person can be really, really helpful and valuable for people. And there's definitely value in that because, the research shows that a combination between manual and exercise provides better outcomes than either one alone.
Well, Laura, thanks for coming on to the Wild Heart Athletics podcast. I really appreciate you taking the time today to talk to us. And I'd love for you to just introduce yourself to our audience and tell us about yourself and some of your background.
So my name is Laura. I am a physical therapist. I've been practicing since 2018. I have my orthopedic clinical specialist certification. So I did a residency after. And I pretty much treat in the clinic, outpatient ortho, and then I also have my own online training business where I help people optimize movement patterns, help reduce risk of injury, and help them improve performance. So that's kind of what I do.
Awesome. So kind of diving in, I'm really curious, like why you chose physical therapy over like other healthcare professions, and like was there like a deciding factor that got you into physical therapy as well?
So yes and no, I guess. I always thought I was going to go into engineering because both my parents are engineers. Like I liked math. It made sense. But then I took calculus when I was in high school and I was like, I will never take a math again. So I have to figure out what else I want to do. And so I kind of just like made a list of a ton of different careers and ended up shadowing a physical therapist and was like, yeah, I can see myself doing that. And then so I kind of knew since I was a junior in high school that that's kind of what I wanted to do. I always had like an interest in the human body and how it moved because I grew up doing gymnastics, and like random little things. Like I somehow knew that like chin-ups bias your biceps more than pull-ups. I don't know how I learned that. I don't know why I learned that, but I just kind of like, so I kind of had some intuition with that kind of thing. So it made sense.
I'm really glad you brought that up because I know on your Instagram you do a lot of calisthenics and strength training. So I'd love to kind of dive into that and elaborate. And if you could explain to some people like the difference and why there's maybe benefits to both, one versus the other. Because, you have the gym bros out there that really don't want to do it, but at the same time, there are benefits. And I'd love to kind of hear your opinion on it.
Yeah, so a lot of times in calisthenics, there's a lot more body awareness and a lot more skill component with it. So it helps with coordination, some of the motor control aspect of things. And it does make it a little bit, calisthenics specifically makes it a little bit more challenging to like progress certain things because it's not as intuitive for just like adding weight or reducing weight. You actually have to change like the lever arm or change the skill for a regression or progression of the skill. But it just helps you move a little bit better. You're not just moving in one plane, you're moving in multiple planes. And I mean, I'm also a little bit biased and I think it applies to, just kind of how we move, like getting up like off the ground, like you can just get up and do like a pistol squat depending, or, however you want to get up. It's a little bit more flexible. There's a lot more mobility as well required in calisthenics. And so there's different things that you can work in different ways. And one necessarily isn't better than the other because obviously consistency over time is the most important. So it's more finding what you enjoy doing and adding aspects of that and making sure you feel good with it.
So how do you kind of apply that to the patients you're seeing both online and in person? And like, how would you program calisthenics into like a rehab setting?
So the rehab stuff that I do is different than the online stuff. But obviously with my knowledge of physical therapy, I'm going to kind of, with my clients, I'm going to make sure they have a good base. And also in the clinic, not all clinics have great equipment available. So like we don't have a whole lot of weight in the clinic. So I'll also sometimes use some calisthenics stuff in there to still make sure I can challenge them to an appropriate level, because sometimes you just don't have that weight available. So that's why one way I guess I kind of use it in the clinic. With my clients, it's more just like making sure you have a good base, and it's dependent on their goals as well. So for example, I'm trying to think of a specific client. Someone that I've been working with has had shoulder pain in the past. She wants to do handstands and skin the cats and things like that. And so we're really making sure that shoulder is stable with the more basic calisthenics progressions. Like closed kinetic chain is going to be a lot more important in calisthenics for a lot of things than most, daily activities, I guess. So working on the shoulder stability and the closed kinetic chain is going to be a little bit more important with that, for example. So just progressing it as it makes sense, essentially, depending on the client goals, more so than forcing calisthenics, I guess, on everyone. So,
is it relatively simple to I'm trying to think of the word, progress calisthenics, kind of like you do with strength training, like an overload kind of principle?
Yeah, so overload principles are always going to apply. It's going to be different than just adding weight. It's going to be increasing the range of motion. It's going to be changing the lever arm because, for example, front levers are a great example of this, or even dragon flags. A straight body is going to be a lot more challenging than a straddle versus a half lay, which is like a bent knee straddle. And then a tuck is going to be easier. And so basically you're going to change the body shape as you get stronger. And that can be applied to planches. It can be applied to levers, dragon flags, and things like that. For like handstand push-ups, for example, you're going to start with like a pike push-up with your feet on the ground. And then you can elevate your feet to basically put more weight onto your hands. And then you can go to like a wall handstand push-up, or like add a little bit of a float at the bottom to like increase the weight on the hands. So there's definitely tons of different ways to progress. It's just going to look a little bit different than just adding weight or reducing weight. But then you can also use bands, which kind of mimic that too, whether you use them for assistance or resistance.
Yeah, I appreciate you kind of talking about that, because that's something I really, especially myself, don't really indulge in as calisthenics enough. But I know there's, like you said, benefits to it, especially when it comes to range of motion, which a lot of us are definitely lacking, especially some of us that lift more than we probably should.
Yeah, if you're trying to do a handstand, you need full overhead motion. For back levers, you need a lot of shoulder extension. And those types of things you're not going to really use a lot in traditional weightlifting as well.
So kind of diving in, you mentioned that you do virtual as well as, in person. Could you kind of describe like how you've seen both your career going in the virtual realm and in person, and kind of like benefits to both? Because I know a lot of people probably are looking at us, and now that I'm in school, I'm seeing the very trajectory of our profession going more towards that virtual route because of social media and stuff. And I'd just love for you to kind of share your experience and maybe where you see us going, or kind of the benefits to both.
I think there are definitely benefits to both. You have to remember with online stuff, you can only provide physical therapy services to the states where you're licensed, and you and the client both have to be in that state. So there are limitations for the online stuff, which is why I don't necessarily do physical therapy online. If they need physical therapy, I'll make sure they're seeing someone in person. And then I can also like tag team that, and we can work around it and on other things. But the in-person stuff is more the traditional physical therapy. I really enjoy that because it's just a different level. Obviously, you're seeing people post-op and things like that. Car accidents, workers' comp, all of that. And then it also like kind of helps me keep my hands-on skills sharp as well. So I really enjoyed that side of things. For the online stuff, I like it because it's a little bit more preventative, where I feel like our medical system is a lot more reactive instead of proactive. So I feel like if we can reduce the risk of things happening, then that's going to put people better in the long run and improve their quality of life for longer, versus just reacting once they already have an injury. So that's kind of where I like the balance between the two. I think the social media side of things makes things a lot more flashy online. But in person can be really, really helpful and valuable for people. And there's definitely value in that because I mean, the research shows that a combination between manual and exercise provides better outcomes than either one alone. And you can't do manual online.
Yeah, that's fair. And I gotta be honest, like after going through my orthopedic class and stuff, I do love the hands-on. It's just the things you can do, like you said, you tag team it both with exercise and manual. It's just that combination effect. I really love how you mentioned though the proactive approach, which I think is something we could definitely talk about more. As one of our professors like to say, fitness forward when it comes to like rehab and stuff. Starting to notice that. What's kind of your take on that proactive approach? Like, what are the benefits to that, and kind of incorporating more exercise into it, and maybe educating people on that?
I mean, we know from the research that the stronger and more mobile you are before surgery, the better your outcomes after a surgery. So even if you need a surgery, the stronger and more mobile you are after or before is going to help your outcomes. Just generally having a balance between muscle groups, making sure you're moving in different planes, making sure you can access and control the range of motions that you need throughout your life and things like that are going to be helpful in reducing injury risk. So it's like if you can, if you're doing deadlifts, for example, in your training, and then you have to go help a buddy move a couch, you're going to be more prepared for that movement pattern in your life, and you're going to reduce the risk that you might get an injury with that. So it's more just preparing yourself for the things that you want to do in life so that you have the range of motion, the strength, and the motor control for it. And that's how you can do that with your training.
So what kind of role does a physical therapist play in that aspect when it comes to like preventative measures?
I think we can provide a different perspective. We can analyze movements typically a little bit better. Obviously, there are some really good trainers out there. There are some really bad physical therapists. So there's going to be some overlap there as well. But analyzing movement patterns, looking at subtle abnormalities that you can potentially pick up on a muscle group that's weaker, or like you can look at that joint might be a little bit tighter, which might be causing X, Y, and Z. I think we can look at that a little bit better. And then we also are more aware typically of some like exercises to target smaller muscle groups a little bit better and be a little bit more intentional in the thought process of why we're doing specific exercises. So like, for example, looking at, shoulder mechanics, how is the scapula moving? What muscles are overcompensating? What muscles are weak to cause that in a functional movement? And then we can add some specific exercises to address that, or potentially even just like change the variation of the exercise that they're doing to bias the muscles that we want to work a little bit more than the other, if that makes sense.
Yeah, no, I appreciate providing like an example too of like how you can target those specific muscles, and especially us being, because I know the APTA I think just came out with a statement, or it's been kind of the ongoing thing, is like us being seen as like movement experts, because I guess people have started using physical therapy as a verb, like I'm going to get physical therapy, which is kind of ironic, but anyways. What are some like other benefits though that we can help people with? I know one thing that I'm very interested in is like pain science. And a lot of people, they feel pain, they take the anti-inflammatories and things like that. And then you have those people that like, especially chronic back patients.
Mm-hmm.
So what's kind of your synopsis on that? Or maybe you could kind of dive into that and what our role is for people with pain.
So pain by definition, or the pain signal it doesn't necessarily indicate tissue damage. It indicates a potential for tissue damage. The signal can change in the sensitivity to your brain. So basically you get a signal from your tissues saying, hey, this might cause tissue damage. Your brain perceives that as pain. Over time, your brain is adaptable and can change. Neuroplasticity is a thing. So you can change the sensitivity of that signal. So it's like a Ring doorbell, for example. You can change the sensitivity of it. It can be a really low sensitivity or a really high sensitivity. So like maybe the wind blows and a leaf goes across it and you get an alert on your phone, versus someone standing there and it's like a really low sensitivity and like it doesn't even pick up that there's a person. So the same thing can happen with your pain signal. Your brain might adapt to, because of, the the chronic nature of symptoms, et cetera, belief, whatever, it can increase the sensitivity where instead of you getting a pain signal from like putting your hand on something hot, it's just a light touch and you get that pain signal. So it's almost, you have to retrain the brain to reduce the intensity or the sensitivity of that pain signal. And that's more where like pain science and things like that comes in.
So what are some ways that you can like kind of train the brain to accept that new pain or kind of that threshold and get familiar with it again?
Honestly, like movement is huge. So providing or allowing them to do a movement and exercise in a way that they don't necessarily have pain. Maybe it's just like a little bit of stiffness or a little bit of tightness. And then they can basically say, hey, like I'm okay moving in these positions or movement patterns. And then understand like, hey, this isn't actually painful. Like I can move here and then slowly increase the range of motion. It is pretty much kind of how I typically go about it in the clinic. Obviously, like some knowledge about the pain science of things and like the signal saying like pain does not mean tissue damage can be really helpful for people, and not necessarily negating their symptoms when like nothing shows up on the MRI or things like that, because pain is more than just, there's nothing wrong with you type thing. Like you can still be getting a pain signal even if there's no tissue damage. So just that knowledge and education can be really helpful. And then that in combination with the exercise in a way that works for them, because what someone might find a certain exercise painful and then someone else may not. And then you have to find out what exactly their body feels good with and then slowly increase it from there.
Yeah, I think that's the big factor, right? Is finding what they're comfortable with, because everybody has their comfort levels and especially what they're willing to do. I mean, for prime example is my grandmother right now. She just doesn't want to do the work she needs to do. And it's just hilarious. But then you have those other people that are like willing to do the work. And so I'm kind of curious, like maybe how you not persuade them, but maybe provide the education when you're working with your patients.
Like to kind of educate them on the importance of what we're doing, or
What we're doing, exercise, kind of like all around like what we do.
so, I mean, honestly, you can provide education, but if they're not ready to accept that, it's like the stages of change. There's like the pre-contemplation, contemplation, and all of that. And if they're not really going to consider that change, then you can throw out ideas and things like that. But it's really hard for them to, or when they're not ready for it, it's hard to make that change. So you can drop little bits and pieces and say like, hey, this is why we're doing it. This is, this relates to your goal via XYZ. But in the long term, they need to understand the importance of those changes. And if they're not willing to make those lifestyle changes or not ready to even consider it, then that's going to be on one side of the thing, or like one side of the story, I guess. The other side, if they're kind of just like asking questions and seeing what they can do, and they understand the importance of it, I'm going to educate them as best I can and just be like, here's what you can do like in the gym to kind of continue this progress here, and just like basically answering their questions, trying to figure out a way that it works in their life. So they can do, because it's not going to look the same for everyone. One person might be able to work out every single day, and not that that's always best, but, and then one person might be trying to fit something in throughout the day with a really busy work schedule. So having advice for both of those populations is going to be really helpful as well.
Do you think that kind of like sets our profession apart, because we can have that conversation and then we understand the concepts of like movement and like how it helps with like quality of life?
Yeah, and definitely because we also spend a lot more time with our patients than physicians do. They're maybe spending 15 minutes with them. We're spending an hour multiple times a week with them typically. So I think we have a lot more time to understand their point of view and what their life looks like, because that's going to play a huge role. Because if you could just give like generic advice of, oh, like you need to, go on a walk for an hour, whatever. I don't know. I'm just making something up right now. Or like work out for an hour a day. And they're just like, well, I'm a single parent. I drive trucks for a living and I'm on the road all day. Like I can't just stop and, get a workout in. And so trying to figure out something that they could do, whether it's like, okay, so you're driving all day, maybe when you stop, do these, 1 or 2 things each time you stop. And so trying to figure out a way that it fits in theirs. And I think we can provide that perspective because we spend a lot more time with them and we're actually communicating with them, having conversations, talking about more than just what they're doing, because conversation is going to happen during that hour. And so we get a better understanding of them and their life too.
Yeah, and like that's definitely not a shot at other healthcare professionals, right? I mean, doctors,
Yeah.
they got a lot going on. But yeah, I agree with you. We have that at least anywhere from 30 minutes to an hour with that one-on-one and meeting them where they're at, both in their personal life, professional life, whatever it is that's going on. That's something that I've noticed too and really respect about the profession.
Yeah.
So kind of reverting back to like the inpatient, how have you started maybe have you seen a change in when you first started practicing to now having a couple of years in the profession?
Oh, definitely, definitely. When I first started, like PT school doesn't necessarily prepare you the best for getting into the field. It basically just tells you or like teaches you how to not hurt people or so having the knowledge and having good mentors when you first graduate is really, really important. So I honestly had multiple amazing mentors when I first graduated, and I did an orthopedic residency. So, and I started kind of reviewing stuff before I even went into residency. So I think I got hired in like August and residency started in January or something like that. So I was reviewing stuff beforehand, and then started formally residency in January. I had like a new grad mentor. Basically, I had 2 residency mentors. So I had resources that I could ask. And I know residencies aren't necessarily for everyone, but it made a huge difference in my career. I would not be the same clinician that I am today without that experience. And talking with some other classmates and things like that who didn't necessarily do residency, I could tell very early on my thought process was different. It was a lot more efficient. I was able to look at things from a different perspective, and it decreased my stress levels in the clinic because I was able to have that knowledge to say like, okay, this is the right thing to do, or this is, the best supported by the evidence. And then I can focus on either doing that intervention, getting my documentation done. And so I didn't necessarily take a ton of notes home as well because I was a lot more efficient in my thought process and in getting things done in the clinic. And so that was like the biggest change, I guess, in my, professional career, was having that residency and having the mentors associated with that as well. So there's been a huge, huge change there. And then just over time, seeing more patients, getting that professional experience is another piece of the evidence-based model. So that's also been helpful.
Could you kind of elaborate like how that really helped your critical thinking when it came to patient care and like how that also like helped you with when it came to patient care?
Yeah. So just, being like a little bit more efficient with like, this is the manual technique that like makes sense for this based on XYZ factor, based on how they're moving. This is the direction that I want to take treatment. And then I can just create a plan a lot faster than saying like, okay, is this better? And then what would that look like? Or is this better? And what would that look like? Or even honestly, just like, I think this is right, but like, I'm not 100% sure. So should I really be trying that? And like going back and forth in your head about it versus just saying like, yep, this is what I'm going to do. Okay, this is how I'm going to do it. And so it just makes that a lot more efficient and allows you to create better rapport with your patients because you're not like in your head so much and you're able to communicate with them. Again, you can be more efficient with your documentation and then have better work-life balance because you're not taking stuff home, and then you can show up better for your patient the next day.
I gotcha. And
Yeah.
I think you mentioned like research and stuff like that, which is very big nowadays with like, mentioning social media again, you have all the gurus and stuff like that. So how do you kind of navigate both the research and then like discussing that with both maybe patients and kind of on your social media?
typically it's breaking down the concepts in a way that is easy to digest. Very rarely will I actually be like, and this study showed this. Pretty much the only, I'm trying to remember which one it was, but it's basically like at 30 years old, X number of individuals have like herniated discs and things like that, but those are without pain. And then like it increases over time. And so like sometimes I'll, mention that to people because they think, oh, I have a degenerative disc disease, so I'm doomed to have pain for the rest of my life, which isn't necessarily the case. So I'll sometimes bring that one out, but a lot of times it's more concepts about the research. And so when something comes, it's just like, I don't necessarily, if I need to look something up, I guess, like I'll go into the research and like deep dive into it at this point. I'm still like doing continuing education and things like that. I also will sometimes mentor residents. And so they're always feeding them the new research and things like that. So I'll kind of get fed it a little bit as well because I'm mentoring them. So that's kind of how I personally stay up to date with things, and then using those concepts to provide the education as needed.
So basically just keep it simple, the KISS method.
Yep.
Yeah, you can get in the weeds a little bit.
Yeah, because honestly, like the average person, like if someone wants to dive deep into it, like, yes, I can definitely do that. But most people don't care that much, and they just want you to get to the point. Yeah. So
that's fair. Their time is valuable too. So yeah. I've seen that before in the clinic.
Yeah.
What was really interesting though is you talked about, your mentoring. So now I'm kind of curious, like how that's really impacted your life and career as well. And like, have you noticed a difference in yourself by mentoring people? Because it seems like you get into that leadership role, you start to really analyze and see things differently.
Yeah, so I've had 2 residency mentors because that's like a year-long process. And then I've had like a couple PT students as well. And it's good to just kind of like refresh of like, this is what I should be doing. And it's like, sometimes you get a little bit, sloppy or things like that, or it's like, I'll do this with most people, but not necessarily everyone. And it's just like kind of a, hey, we really should be doing this with everyone. Like, so like test, treat, retest, for example, things like that. It's just like easy to kind of just say, oh, like hop on, like I know what's going on, instead of just like actually assessing just super quick. So it takes a second. And actually explaining the thought process a little bit makes you just think about it a little bit more. And just questioning, saying like, okay, is this the best? Or is there something that's better that we could be doing? So that's kind of where the mentoring is helpful, because you're really discussing it with it and discussing things with them and kind of challenging them. And then you have to think about things differently as well. And sometimes they'll ask questions where you're like, okay, let me like look into this a little bit more, or like, and then you can kind of like dive deep into that with them as well. So I really enjoy it. It kind of keeps you on your toes a little bit more.
So what are some like benefits you've seen from like educating and mentoring others?
It's more the, making sure you're continuing to provide the best care that you can, thinking about things in a potentially different way, because you're like, okay, like what exercise would be good for this? And then they'll come up with like a couple different variations, and one of them might be like absolutely appropriate, but your just brain didn't think of it. And so it's like, okay, yes, that will work. And then sometimes it's, challenging, saying like, okay, what was your rationale for this? That's more like, so just coming up with exercises more like PT student, and then like the residents, like, okay, what was your rationale for doing X, Y, and Z? What was your rationale for the order of X, Y, and Z? And things like that. And so it's just more challenging that, and then just learning different ways of thinking to some extent.
Yeah, you hit that right on the head, coming up with an exercise versus the rationale. That's the hard part. I'm in those shoes right now. I'm like, this will work. Why? I don't know. I don't know. It works. Well, that's awesome.
Yeah. Yeah. It's definitely a challenge as a PT student, because you're just getting thrown into the fire with everything. But it gets better.
Yeah. It's like the fire hose of knowledge right to the face.
Yes. Yep.
That's how it is.
Heard that analogy before.
Did you ever think you would like be mentoring others though?
Honestly, I didn't necessarily think too much. Like, I never would have thought my career went this direction. I envisioned myself being a full-time physical therapist. And then for some reason, at one point I was like, I'm going to coach gymnastics after. So it's like, I would go to the clinic during the day, and then I would go coach gymnastics after. And that never happened. And I was more like, potentially like undergrad type thing. I never would have thought that I wouldn't be treating in the clinic, and I never would have thought that I would have had my own business. But when I was in the clinic, I was like, this isn't 100% like what I want to be doing all of the time, because you just see, the prevention side of things is missing. Some like in a traditional healthcare model, at least in the US, like they're referred by doctors, and sometimes they just don't want to be there and they don't see the value in it. And that is very frustrating, and it's very draining sometimes to be doing that all of the time. And so the online stuff I find really rewarding, because it's people want to be there. People are willing to put in the work a lot more. Granted, things I feel like are changing with direct access becoming more of a thing and things like that, where people in the clinic or more people in the clinic are more wanting, like they're coming directly to you. Physical therapy is getting a little bit more of a name for themselves, so people understand the value of it a little bit more, versus just saying like, I'm here because my doc wants me to be here. So that's kind of, it can be, again, a little bit just draining in the clinic, things like that, where I feel like the balance between the two of like the online and the in-person things is what I found has been the best for me personally, just from like a balance standpoint, I guess. So yeah, definitely didn't think my career was going to go this direction.
Could you kind of dive into that and elaborate a little more on like the balance of like working in the clinic and then having your own? Because I know there's going to be probably people listening to this, and myself included, are already thinking about how we can balance something that we can do ourselves and then at the same time working in the clinic. Because we've both said the hands-on experience is unparalleled, and you can't get that in the online space.
Yeah. So for me, for example, I'm very much an introvert. So having the quiet time and constantly going in the clinic was very draining for me. And then you also have to think about like the emotional load, because people are coming to you with problems that you 100% want to help people with, depending on your capacity. It's hard to not necessarily sometimes take those things home. And so having a little bit more time still helping people is helpful, I guess, from that balance standpoint for me personally, just because the emotional burden, I guess, when I was treating 40 hours a week and just like how much energy is required to be on for that many hours for me was very challenging. I'm not saying I didn't enjoy it. I did. But for me, the balance of being able to do things a little bit more on my own schedule was very helpful for me. And I think it's going to be dependent on person to person, what's going to work best for them. Because some people, really, really enjoy being in the clinic. Some people, might enjoy a different setting versus what they are currently doing. And PT does have a little bit higher like burnout rate as well. So I think having a balance between the two is helpful too, for me at least, from a burnout standpoint.
Did it like take you a while to figure that out, or did you kind of already know? Because you mentioned you're an introvert, so did you already kind of have an idea of like your personality and what you can and can't handle, or did it take kind of like a epiphany moment?
Lots of trial and error. And I'm still trying to figure out a balance of things. Things are constantly changing. Like I currently have a student that I split with another physical therapist. And so I increased hours to kind of help out with that for a couple of weeks. And so learning because I was just like, oh, like I should be able to handle that, no problem. And then I was like, oh wait, like this is actually very challenging for me just because of like how much work I have to do outside and how much work is required, or how much time is required more so in the clinic. And just trying to find a balance of still being able to have some like downtime and spend time with my husband, things like that. Like it was a little bit more challenging for those weeks. So it's more just trial and error for me, and just realizing like, oh wait, I can't do that, because I always try to put more on my plate than I can handle. And it's an aspect of being like, oh wait, I can't do that now. Okay, let's drop it. And it's going to change over time as well.
Yeah, it's just like you said, it's just kind of your career and kind of where your trajectory is going. But that's great that you've kind of got that balance now, and it seems like it's working really, really well.
Yeah, for now.
Yeah,
we'll see what happens. We'll see what happens going forward. I've learned to just like, I don't know what's going to happen, so we'll just go with it when things pop up. and then adapt from there. So it's always changing.
Yeah, it's the fun of it, though, you know.
Definitely, definitely.
I'd like to kind of touch on the direct access, you know, for physical therapy. I think a lot of people don't really understand that. And I know in one of our classes we were having, it was when we were doing low back and hip, and we were talking about direct access and how some people, you know, go right to their doctor to get whether it's the medication they need or something like that. I don't know if that's just how society has always been. And could you talk about the benefits of like going to physical therapy first before going to a doctor? And again, this is not a shot. We're not taking shots at healthcare professionals. Like they play a role, and there's a time to go see your doctor. But I think there's a great thing about physical therapists being able to have that direct access and us getting more and more patients instead of having to go straight to the doctor then come to us.
So I'm just going to use my mom as an example. I was up visiting her. She ended up waking up with BPPV. So basically, she was just very dizzy. We were playing ridiculous games the day before, so I'm pretty sure that contributed, but that's a separate story. So basically, I was like, okay, she has a history of headaches, things like that. So like, let me just like real fast see, if it's cervicogenic. Quickly realized like it was not. I was like, okay, like let's rule out blood pressure, all of that stuff. So we ended up going to like the fire department for them to check her blood pressure. Blood pressure was fine. It had helped a little bit when I did a little bit of like manual stuff, but wasn't 100%. And so I was like, okay, like let me, test for BPPV. And this was basically instead of waiting, I don't know how many weeks it would have taken to get into the doctor and then referred to PT and things like that. She was feeling better later that day and was able to kind of like get back into the family activities. And then you don't necessarily see those brain changes with, like visual tracking and things like that, because she was able to get in, or like I was able to do something really fast, basically the day that it happened. And then also like for low back pain, it's very helpful to get in sooner than later, because again, the longer that things go, you end up having those changes in the brain. Those muscles are a little bit tighter or a little bit stiffer. Like they're not necessarily, it just takes longer to kind of get back to where you were, because maybe you're avoiding things for longer. Maybe you get a little bit weaker because you're avoiding things. All of that stuff is going to play a huge role. So getting in sooner is going to be better to keep you moving for longer, essentially. So that's where the direct access comes in. Obviously, it's going to depend on the state that you are in. So like for Georgia, for example, it's 21 days or 8 visits, whichever one comes first. And so it'll get you started, but it's not going to oftentimes get you through your plan of care. So that's where it's still important to, at least in Georgia, go see your doctor so you can continue to make those improvements.
Well, like, and you said, some people would like try to avoid those movements and stuff like that. And like looking at both research and what we know, avoiding that initially, it might be okay. You might need that calm down period. But then, like you said, if you wait 4 days, it still doesn't calm down. And then you can find out it's like a muscle issue or a skeletal issue. That's kind of where we come in. And not avoiding that can actually help, like you said, with that pain and other things.
Yeah. And maybe it's just an aspect of controlling the load through something. So maybe it's like that movement is fine, but maybe you just need to modify it in a certain way. And we have a little bit more knowledge to be able to kind of like coach and guide based on how they're moving and things like that in a specific person.
Yeah, and going beyond the musculoskeletal too, right? Because you said your mom, you were testing out kind of like headaches and other things, and that's more of a neurological issues for those that are listening. Because PVV, that's a big word.
Yeah, so basically, like it's the crystals in the ear that can kind of get out of place, and then you basically have to put them back in place. But then you can also get like cervicogenic headaches, which are musculoskeletal, because you can have like your upper cervical spine can refer to different areas, and same things with some of those muscles around the base of the skull can also refer up into the head and cause some headaches. So physical therapy can help with more than just the like back pain, neck pain, things like that. We can also help with some dizziness, some headaches, pelvic floor dysfunction, things like that.
And what I just learned, I did clinical neuro, so now we're talking about strokes and other things too, which is just very fascinating how the brain works. And
yes.
the body's is just so resilient. It's incredible.
Yeah, definitely. It's the changes can be positive or negative, and you want to use exercise to kind of help that in a positive way, and stay moving so your brain doesn't change in a negative way and things like that. So it's just interesting. Yeah, for sure.
Awesome. Well, so now I'm kind of curious, like, how do you want to be remembered as like with a physical therapist and kind of with your online stuff you have going on?
I mean, I don't necessarily think about that a whole lot. I guess it's just like if I can get one more person moving in a way that makes them feel good so they can do things that they enjoy for longer, that's going to be the end goal. It's more just about allowing people to improve their quality of life and keep their quality of life for longer is kind of my goal with things. So like I've worked with, a 70-something-year-old who had Parkinson's, and she was trying to get her handstand and doing toes to bar because she wanted to do those things and it was fun for her. So just being able to do things like that, however it works for you, is kind of, I guess, the goal. I always think about, I don't know what commercial it was years ago where it was like this grandpa was trying to lift a kettlebell. And it was basically to lift this, the kid, his grandkid up to put the star on the Christmas tree. And so he'd been training for months and everyone thought he was crazy. And I was like, it's just, however, one person it might be, lifting their grandkid. The other person it might be, getting a handstand. The other person it might be just like being able to get up and down off the ground to play with their kid. Like different things are going to be different goals for other people, but it's however they want to move, however they want to live their life, and being able to provide them a way to be able to do that for longer is the goal.
Yeah, I love how you mentioned like quality of life. And so I'm kind of curious, like, granted, it's very goal dependent on the person, right? Like the grandpa that wanted to lift their kid and was using the kettlebell. So what are some ways people can maybe extend that quality of life? Because I think that's something we could definitely discuss for a little bit.
I mean, again, dependent on goals, but just being able to have the strength to get up off the toilet without having to worry about falling or struggling. Being able to, walk for a certain amount of distance so that you can go do something. So like I'll use my dad, for example. He had been overweight for a fair amount of time growing up. Everyone was just kind of like, oh, like you should probably lose weight. And he's like, he kind of was in that like pre-contemplation kind of stage. And then it was his value system is family time. So we were on, I forget what amusement park we were at, but basically he kind of struggled to get the, like, I don't know, the thing down for the roller coaster. And that was his like, oh my gosh, I need to make a change moment. So when we got back from that trip, he started to eat a little bit better, things like that. And I mean, he lost the weight and has continued to maintain that weight loss. So there's that. And then also he'll exercise. He hates exercising, but he will exercise more because if we're going on like a family trip, on like a hiking trip, all of a sudden he's like biking and walking a lot more and things like that. So finding the motivation, whatever it is for you, and you can use training essentially to do that, to, do the things that make you happy. Like patients, knee replacement for I'm thinking of a patient specifically, and she was on the first day. She's like, I want to get up and down off the ground to play with my grandkid. And I was like, awesome. Wrote that down. Like I was like, okay, this is going to be the goal. And then we started working on kneeling, and she's like, why are we doing this? And I was like, so you can get up off the ground to play with your grandkid. She's like, oh, okay. So using, individual factors to be able to just essentially do things that, everyone has their own thing that makes them smile. It might be a little bit different, and allowing them to have the body to be able to do that is helpful through training, whether it's the motion, the strength, the control, whatever it is. So PT and training in general can help with that.
So overall, kind of like the benefits of exercise along with like other things.
Yeah. Just because like, mobility can be something, whether it's like, maybe you're, like getting your shoe on, you have to, however, varies how people get their shoes on, but like crossing their ankle over their knee. And it's like, oh, having knee pain, but like, okay, what's happening at the hip? Okay, maybe there's that's increasing the stress on there. And that can improve quality of life because they can just like hop that on really fast and then get going running after whoever they want to run after. So just the general strength, range of motion, control is going to allow you to do a lot.
Yeah, I really loved how like it's not just one thing, right? Like you mentioned the person crossing the leg over, maybe they don't have knee pain, but like is it at the hip? And I think you could say we're like glorified investigators is probably a good way to say it.
You're always trying to figure out like how the pieces of the puzzle fit and what's the missing link and things like that. So it's like engineers for the body almost. I've heard that analogy before and I'm like, that definitely kind of fits. It's like you're just the building blocks and trying to figure out what's going on and what's wrong and fix it. So
yeah, I'm gonna steal that, the engineers of the body. I like that.
Yeah.
Awesome. Well, Laura, I really do appreciate your time this afternoon. Come and talk to us. I know you got some stuff so you got to get done, and it's been a great time. I'm so glad I got to meet you and finally talk to you in person. I appreciate all your insights.
Yeah, of course. It was so nice to chat with you. Thanks for having me on.
Yeah, and so people can just find you on Instagram and things like that.
Yes. So Paradigm of Perfection is my handle. And then paradigmofperfection.com is also my website. So you can kind of check out any of the free content that I have on Instagram. I have some blogs on my website that are also free. And then I have my own app and I do work with people online. So everything's on the website, basically.